Knock knock, shutting the door for privacy. Hello, my name is Jessica. I'll be your nurse today, and I'm going to wash my hands for 20 seconds per CDC guidelines. Can I see your wristband, please? And can you tell me your name and date of birth?
Roxanne Vale, 51567.
Thank you. Do you have any allergies?
No.
Are you having any pain today?
No.
Okay, and if she did have pain, I use OPQRST to assess. I'm here today to do a physical assessment from head to toe, and I'm going to touch and listen to different parts of your body to make sure there are no abnormalities. Is that okay?
Yes.
Okay, and then can you tell me where we are?
The hospital.
Can you tell me what day it is?
Saturday.
And why are you here?
For checkup.
Okay, so the patient is alert and oriented times 4. She is in a good mood. She's well dressed and, she's well groomed and dressed appropriately. And she's in no apparent distress. And then I know that they checked your vital signs before you came to the room, and they were within normal limits. And your vision test on the Snellen chart was 20/20, so cranial nerve 2 is intact. So I'm going to start off on your head. And I see that the head is round and symmetrical. Her skin matches her ethnicity. There's no facial drooping at this time. No redness lesions or visible scarring. I'm just going to touch your head. Let me know if there's any pain or tenderness anywhere as I touch.
No.
Okay, and then there's no infestations. The hair is evenly distributed. There's no redness, no bumps or masses. And then now I am getting some hand sanitizer, and I'm going to look at the eyes, and her eyes are symmetrical. There's no drooping. The sclera is white, and I'm going to check your eyes. So look at the tip of my pen light and follow without moving your head. Okay, now I'm going to shine the light in your eyes. Just look right behind me. Okay, thank you. So pupils are equal round reactive to light and accommodation. Extraocular movements are intact. So cranial nerves 3, 4, and 6 are intact. Now I'm looking at the ears, and they are symmetrical and they sit evenly on her head. I'm going to look for any drainage or redness, and it is not present at this time. I'm going to go ahead and touch around your ears. Let me know if there's any pain or tenderness.
No.
Okay. And then I am going to check your lymph nodes. Let me know if there's any pain or tenderness at all. So starting pre-auricular, parotid, post-auricular, occipital, posterior cervical, glossopharyngeal, anterior cervical, submandibular, submental, and supraclavicular. Any pain or tenderness?
No.
Okay, and her lymph nodes were not palpable. Now I'm going to look at the nose. I see that it's midline. Can you put your head back for me, please? There's no septal deviation, no polyps, no redness, no drainage. Do me a favor and close your eyes and cover one nostril. Tell me what you smell.
Peppermint.
Okay, other side. Keep your eyes closed. What do you smell?
Peppermint.
Okay, thank you. So ocular mode, cranial nerve 1 is intact. So now I'm looking at the mouth. I see that the lips are pink and moist. Go ahead and open for me, please. So dentition is intact. Her teeth are pearly white. Mucosa is pink and moist. There's no redness, lesions draining. Her tongue is pink and rough. Stick your tongue out for me, please. Say ah. Okay, thank you. Uvula is midline, and her uvula and soft palate rise. And then I'm just going to check your gag reflex. Okay, thank you. So gag reflex is intact. And then, can you stick your tongue out and move it up and down? And then side to side. Okay, thanks. And then I'm going to touch your neck. Can you swallow for me, please? Okay, thank you. So cranial nerves 9, 10, and 12 are intact. Yeah. Okay, so now can you close your eyes? And let me see your, ow. Let me see your hand. Okay. This is sharp.
Mm-hmm.
This is dull.
Mm-hmm.
Do you feel that?
Mm-hmm. Yes.
Okay. And then tell me what you feel on which part of your body.
Dull on my arm. Dull on my knee.
Okay. And then can you open your eyes, raise your eyebrows for me, please, and smile and frown. That is not frowning. Puff your cheeks. Okay. And then unpuff your cheeks now. And push your tongue to this side. Okay, now this side. Okay, now open your mouth and close. Okay, thank you. So cranial nerves 5 and 7 are intact. So now I'm going to move to the neck, and I see that the trachea is in midline, and there's no redness or any visible bumps. Now can you turn your head to that side and then the other side? Okay. And now push my hands up with your shoulders. Okay, so cranial nerve 11 is intact and there's no JVD noted. Now I'm going to check carotid pulses one at a time. Okay. And I'm checking breathes, so take a breath and hold. Okay, thank you. And again. Okay, thank you. There's no bruise noted at this time. Now I'm going to, did I say carotid pulses were pleasant +2? Okay, well they are. Now I'm going to I'm going to palpate for the thyroid and swallow. Okay, thanks. So the thyroid gland is palpable and movable. Now I'm going to check skin trigger. Skin trigger return is immediate. Now can you put your hands out in front of you and squeeze my fingers? Okay, now lift your arms. Okay, now push down. Okay, now put your hands to the sky and to the side and flex on right, put them down. So, why am I going to say brain? Range of motion is intact. Strength is equal bilaterally. I'm going to check your brachial, just kidding. Brachial pulses, radial pulses, they're both breast +2. Her skin is matching her ethnicity. The hair is evenly distributed. The temperature is warm.
How do you know?
Because I already touched you. Touched your brachial and your radial. And capillary refill is brisk and less than 2 seconds. Okay. Now can you open your gown for me? So the skin matches her ethnicity. There's no redness, bumps, lesions, scarring visible. Her chest rises and falls evenly. There's no use of accessory muscles and no nasal flaring. Now I'm going to put my hands on your chest. Take a deep breath. Okay, thanks. Now I need you to take a deep breath. Okay, thanks. Okay, take a deep breath. Okay, thanks. So her chest expands and retracts evenly. And did I already say my word breathing? I think that's it. Okay, so now I'm gonna listen to heart sounds. So just relax, and I'm gonna start with the right sternal border, second intercostal space for aortic, and S2 is greater than S1. Left sternal border, second intercostal space for pulmonic. S2 is greater than S1. Left sternal border, third intercostal space for Erb's point. S1 and S2 are equal. Left sternal border, fourth intercostal space, tricuspid. S1 is greater than S2. And then left midclavicular, fifth intercostal space for the mitral. And S1 is greater than S2. At this point, I would have the patient lean forward, listen to the apical pulse, for 1 full minute, compare it to the carotid, and then I'd flip my stethoscope to the bell and listen to each of those landmarks for any murmurs or bruits. Now I'm going to listen to the lung sounds. So you're going to feel my stethoscope on your chest 6 times, and I want you to take a deep breath every time you feel it. Okay, same thing on your back, but it's going to be 8 times now. Okay, so lung sounds are clear bilaterally, no crackles, rhonchi, or wheezing noted. And now you can put your gown back on. And then if you can lay down for me, please, I'm going to check your abdomen. Can you tell me when your last bowel movement was?
This morning.
What color was it?
Brown.
The consistency?
Soft.
Last time you urinated?
An hour ago.
What color was it?
Clear.
Okay, and was there any pain or burning?
No.
And any foul odors?
No.
Okay. So then can you expose your abdomen for me, please? So I see that her skin matches her ethnicity. The abdomen is flat. And there is no visible bumps or lumps. And now I'm going to listen to bowel sounds in all 4 quadrants. And bowel sounds are active and irregular in all 4 quadrants. Now I'm switching to the bell and listening to the abdominal arteries, starting with the aortic. And then right renal, left renal, left, is it iliac or inguinal? Okay. And then right iliac,
Inguinal down here.
and then right femoral, and left femoral. And there's no rulies noted at this time. Now I'm going to lightly tap. Let me know if there's any pain or tenderness. Okay, now I'm going to push lightly. Is there any pain or tenderness?
No.
Okay, and there is no bumps or palpable masses. So you can cover your stomach, and now I'm going to move to the legs. I see that the legs are even. The skin matches her ethnicity. The hair is evenly distributed. There's no redness, lesions, or scars. There's no bruising, no edema noted, and no visible bumps. So now I'm going to touch with the back of my hand for temperature, and it's warm. I'm going to palpate posterior tibialis pulses and dorsalis pedis. They're both present +2. I'm going to check capillary refill on all her toes, and they are brisk and less than 2 seconds. So now can you lift your leg up? Put it down. Now out and around. Okay, then the other one up, out, and around. Okay, now knee to your chest. And knee to your chest. Okay, now can you push on my hands like pedals and toes to your nose? Okay, thanks. And then can you lift your legs?
I can't.
Thanks. Down. Okay, thanks. The range of motion is intact. Strength is equal bilaterally. And then can you sit up? And then can you touch all your fingers as fast as you can? Okay. And then this heel, put it to this knee, and then push down, and then the other side the same. Okay, so upper and lower cerebellar reflexes are intact. Now can you stand up and walk to the shoe rack and come back? So gait is steady. Now can you turn around and look at the picture? And
what a pretty picture.
With your feet together and your hands at your side, close your eyes. Okay, you can open and then stay right there and tell me what you hear.
ABC.
And one more time.
1, 2, 3.
Okay, we can turn around and have a seat. So cranial nerve 8 is intact. And now I'm going to check your reflexes, starting with the tricep. Okay. And now the bicep. And the brachioradialis. Okay. And on the other side, tricep. And bicep. And brachioradialis. Okay, and patellar. Okay, patellar. Okay. So deep tendon reflexes are intact, and that completes our assessment.